Hey, let's discuss minoxidil. Minoxidil was approved by the FDA for growing hair in the back of the head, but it will grow hair in the front of the head as well. A lot of patients ask that. Will it grow hair in the front? Yeah, it will. It'll grow hair wherever you put it, but it doesn't grow a lot of hair. It grows a little bit of hair. It mainly grows peach fuzz and some very fine short hairs. It's not a fantastic product for regrowing your hair. They started out with a 2% solution, and then it moved to a 5% solution. One of the biggest issues with minoxidil is that the original formulation came with propylene glycol. And propylene glycol is antifreeze. Propylene glycol can be very irritating to the skin. When they came out with the foam version of minoxidil, they took the propylene glycol out, and a lot of people that had allergic responses to the propylene glycol do just fine on the foam. However, some people respond better to the propylene glycol version than the foam version in terms of irritation to the skin. Now, there are other products that act similar to minoxidil, the WNT upregulators like WNT Act, Nizoral shampoo, 2% twice a week, shampoo in, leave it on for about 5 to 10 minutes and rinse it out. The best combination today would be a topical finasteride, starting at maybe a 1%, mixed with 5% minoxidil solution, applied daily. You could increase this to a 2% finasteride. You don't really get any better response out of minoxidil when you go to above 5%, but you can get a slight improved absorption if you add retinoic acid. Now, even better than the topical minoxidil is the topical finasteride, but if you move to the oral minoxidil, it is superior to the topical minoxidil, and we use the oral minoxidil in both men and women, and you actually see a visible improvement when you move to the oral minoxidil. So these are some options for you for trying to slow down your hair loss or reverse your hair loss, because it's very important to try to maintain your hair as long as possible. The hair follicle just was not developed to last until you're 90. And of course, today we have people that are living to 90, and we want to keep your hair looking like you're 40 or 30 when you're 90. And so if you start anti-aging medicine at age 89, well, I got to tell you, you're not going to look 40 when you're 90.